Hi, this is My Mental Health Mind, a new channel on YouTube. I am Tyson King and I have a bachelor's in social work and psychology. I will be your presenter for these videos. On this channel, we will talk about mental health disorders, ways to cope, how to help, and much, much more. Today, we are talking about the 10 common mental health myths and the truth surrounding them. 10 myths of mental health. 10 myths of mental 10 myth. Mental illness only affects certain groups of people. Fact. Mental illness, like physical illness, can affect anyone regardless of intelligence, social class, or income level. It's crucial to dispel the misconception that mental illness only impacts specific groups of people. Mental health conditions can affect individuals from all walks of life, regardless of their socioeconomic status, educational background, or cultural identity. The reality is that mental health does not discriminate and can affect anyone, emphasizing the importance of understanding and support for all individuals experiencing mental health challenges. The impact of mental illness is far reaching and can affect individuals in various ways, regardless of their external circumstances. Therefore, it's important to recognize that mental health conditions can manifest in anyone, and providing support and understanding to individuals experiencing mental health challenges is essential. By acknowledging the universality of mental health conditions, we can work together to create a more inclusive and supportive environment for all individuals, regardless of their background or social standing. Mental illnesses are among the most common health conditions, with more than 1 in 5 U.S. adults living with a mental illness. Treatment for mental health disorders can include therapy, education, medication, and support systems. With appropriate screening, treatment, and support, many people with mental illness can recover and live well. 9. Myth. People with mental illness are more likely to be violent. Fact. People with mental illness are much more often the victims of violence rather than the perpetrators. Individuals with some types of mental disorders are more likely to be violent than others in the general population, but the majority are not violent. Research and studies have consistently shown that individuals with mental illness are not inherently more violent than the general population. However, it's important to note that the prevalence of violence among individuals with mental health is still relatively low, with only a small percentage engaging in violent behavior. The relationship between mental illness and violence is multifaceted, and it is influenced by a range of factors, including substance use, environmental stressors, and individual circumstances. It is crucial to avoid oversimplifying this complex relationship and to consider broader contexts when discussing mental illness and violence. Individuals with mental illness are more likely to be victims of violent crime than perpetrators. This highlights the vulnerability of individuals with mental health conditions and challenges the misconception that they are primarily responsible for violent acts. 8. Myth. Mental illness are not treatable health conditions. Fact. Mental illnesses are treatable health conditions that can affect anyone regardless of gender, age, race, or income. There are many treatments, services, and community support systems available, and studies show that people with mental health conditions can get better, and many are on the path to recovery. Mental illnesses are recognized as medical conditions, similar to physical health issues such as heart disease or diabetes. They are characterized by changes in a person's thinking, feelings, or behavior, and can cause significant distress and difficulty in functioning. It's crucial to understand that mental health conditions are legitimate health concerns that require appropriate treatment and support. This includes evidence based treatments, therapy, medication, and support services. The goal of treatment is to enable individuals to effectively function in their daily lives, maintain healthy relationships, adapt to change, and cope with adversity. The vast majority of individuals with mental illness continue to function in their daily lives. With appropriate treatment and support, many people with mental health conditions can experience relief from their symptoms and return to full functioning. Stigma surrounding mental illness has contributed to unwanted barriers to effective treatment and recovery. It's essential to address societal attitudes and structural barriers that hinder individuals from seeking and receiving the necessary support for their mental health conditions. By dispelling misconceptions and promote accurate information, we can work towards breaking down these barriers. 7. Myth. There's nothing I can do to help someone with a mental health problem. Fact. There are many things you can do to help someone with a mental health problem, including providing support, helping them find mental health services, learning about what they are going through, treating them with respect, and encourage them to be physically active. Encourage the individual to create a support network consisting of friends, relatives, and mental health professionals who can provide assistance and guidance. Having a strong support system can significantly impact their well being and recovery. Educate yourself. Learn more about the specific mental health problem the individual is experiencing. Understanding their condition can help you provide more effective support and empathy. Access to the right information is vital in offering meaningful assistance. Support the individual in seeking professional help and accessing appropriate mental health resources. Be patient and allow them to set the pace for seeking support themselves, while also providing encouragement and guidance. It's important to be patient and understanding when supporting someone with a mental health problem. Listen to their thoughts and feelings and respect their pace for seeking help. Patience and empathy are crucial in providing effective support. Provide practical assistance, such as helping with household chores, suggesting activities to do together, or simply spending time with the individual. Small gestures of support can make a significant difference in their well being. Advocate for the individual's right to receive support and respect. This may involve challenging stigma, providing information about mental health, and promoting understanding and empathy within the community. Help the individual address any barriers they may face in accessing mental health treatment. This could involve supporting them in navigating the healthcare system, addressing negative experiences, and developing coping techniques while on waiting lists for the treatment. 6. Myth. Mental illnesses make someone unable to function in normal society. Fact. While some mental health disorders can be debilitating, many people with mental illnesses are still productive members of society. Mental illnesses can lead to a range of symptoms, including hallucinations, delusions, disordered thinking, and extreme emotional distress. These symptoms can significantly impair an individual's ability to carry out daily activities, maintain relationships, and fulfill responsibilities. It's crucial to recognize that mental illnesses are not a choice, a weakness, or a character flaw. They are legitimate health concerns that can cause distress and impairment in important areas of functioning. The impact of mental illness on daily life can vary widely depending on the specific condition and the individual's unique circumstances. Severe and persistent mental illnesses, such as schizophrenia, bipolar disorder, severe forms of depression, panic disorder, and obsessive compulsive disorder, can interfere with an individual's ability to function in society. These conditions may require comprehensive support and treatment to help individuals manage their symptoms and improve their daily functioning. Societal perceptions and stigma surrounding mental illness can further exacerbate the challenges individuals face in functioning within normal society. Misconceptions and stereotypes about mental illness can contribute to social withdrawal, isolation, and reduced participation in daily life activities. While mental illnesses can impact an individual's ability to function in normal society, it's important to emphasize that these conditions are treatable. Access to appropriate treatment, support services, and understanding from the community can significantly improve an individual's ability to manage their mental health and engage in daily life activities. 5. Myth. Children don't experience mental health problems. Fact. Children and adolescents can also experience mental health disorders. These may include anxiety disorders, attention deficit hyperactivity disorder, ADHD, depression, and more. Children can indeed experience mental health problems, and it's important to recognize and address these issues. Mental disorders among children are described as serious changes in the way children typically learn, behave, or handle their emotions, which cause distress and problems getting through the day. Many children occasionally experience fears and worries or display disruptive behaviors. If symptoms are serious and persistent and interfere with school, home, or play activities, the child may be diagnosed with a mental disorder. It's important to note that mental health is not simply the absence of a mental disorder. Children who don't have a mental disorder might differ in how well they are doing, and children who have the same diagnosed mental disorder might differ in their strengths and weaknesses and how they are developing and coping. Children's emotional well-being is just as important as their physical health. Good mental health helps them develop the resilience to cope with whatever life throws at them and grow into well-rounded, healthy adults. It's crucial to recognize that children's mental health concerns can significantly impact their overall well-being and development. Certain risk factors can make some children more likely to experience mental health problems than others. However, experiencing these risk factors doesn't mean a child will definitely or even probably go on to have mental health problems. It's important to provide support and resources to children who may be at risk of or are experiencing mental health challenges. Untreated mental health problems can disrupt children's functioning at home, school, and in the community. Without treatment, children with mental health issues are at increased risk of school failure, contact with the criminal justice system, and dependence on social services, and even suicide. Identifying mental disorders in children can be tricky for healthcare providers, and it's crucial to seek professional help and support for children experiencing mental health problems. 4. Myth. People with mental health issues should just snap out of it. Fact. Mental health problems are not a choice, and individuals cannot simply snap out of it. Support, understanding, and appropriate treatment are essential for recovery. Telling someone with a mental health issue to snap out of it is not an effective or compassionate response. Mental health disorders are medical conditions, not simply a matter of mood. Just as one cannot will themselves to recover from a physical illness like pneumonia, individuals with mental health disorders cannot simply snap out of it. These conditions often require professional treatment and support to manage effectively. Stigmatizing attitudes and misconceptions about mental health can lead to harmful beliefs, such as the idea that individuals with mental health issues can easily overcome their challenges if they just try harder. This stigma can create unreasonable expectations and unnecessary suffering for those suffering mental health disorders. Comparing mental health issues to physical health conditions can help illustrate the complexity of mental health. Just as one cannot expect a person with a broken leg or diabetes to snap out of it, it's important to recognize that individuals with mental health disorders require understanding, support, and access to care. Mental health disorders often require professional intervention, including therapy, medication, and other forms of support. Encouraging individuals to seek professional help and providing understanding and empathy can go far more beneficial than expecting them to simply overcome their challenges on their own. 3. Myth. Mental health problems are a sign of weakness. Fact. Mental health problems are not a sign of weakness. They are legitimate medical conditions that require professional treatment and support. Mental health problems are not indicative of weakness. Rather, they are recognized as medical conditions that can affect individuals from all walks of life. Experiencing a mental health problem can be upsetting, confusing, and frightening, and it is not a reflection of personal weakness. These conditions are often influenced by genetic and environmental factors, and they require understanding, support, not judgment or stigma. Mental health problems are complex and can be influenced by a variety of factors, including genetic predisposition, environmental stressors, and social deterrents. The cause of mental health problems are multifaceted and do not stem from personal weakness. It's important to realize the resilience and strength that individuals with mental health problems often demonstrate in managing their conditions on a daily basis. Mental health problems can significantly impact an individual's emotional, psychological, and social well being. They are not a reflection of personal weakness, but rather a manifestation of the complex interplay of biology, sociology, and social factors. Recognizing and addressing mental health problems require empathy, understanding, and access to appropriate support and treatments. Individuals experiencing mental health problems require compassion, understanding, and access to professional support. Encouraging open conversations about mental health, addressing stigma, and promote access to resources and treatment are essential in supporting individuals with mental health challenges. 2. Myth. Seeking help for mental issues is unnecessary. Fact. Seeking help for mental health issues is crucial. Professional support and treatment can significantly improve an individual's well being and quality of life. Seeking help for mental health issues is not unnecessary. In fact, it is crucial for promoting well being and addressing mental health challenges. Seeking help for mental health concerns is essential for addressing and managing these issues effectively. It allows individuals to access professional support, treatment, and resources and can significantly impact their mental well being and quality of life. Despite the importance of seeking help for mental health issues, various barriers such as stigma, lack of awareness, and negative experiences with the healthcare system can hinder individuals from accessing the support they need. Understanding and addressing these barriers is crucial in promoting help seeking behavior. Seeking help for mental health concerns can lead to numerous benefits, including improved mental well being, enhanced emotional health, increased productivity, and better overall quality of life. It is a brave and beneficial step towards addressing and managing mental health challenges. Access to mental health professionals, support services, and resources is essential for individuals seeking help for mental health issues. Creating a supportive and understanding environment, as well as promoting awareness and access to mental health care, can encourage individuals to seek the help they need. 1. Myth. Mental health problems are caused by personal failings or personal flaws. Fact. Mental health problems are not caused by personal failings or character flaws. They are a complex condition influenced by various biological, sociological, and environmental factors. Mental health problems are not caused by failings or character flaws. Mental health problems are recognized as medical conditions that can affect individuals from all walks of life. They are not indicative of personal failings or character flaws, but are complex conditions influenced by genetic, environmental, and social factors. Mental health problems can significantly impact an individual's thoughts, perceptions, feelings, and behaviors. They are not a reflection of personal weakness, but rather a manifestation of the complex interplay of biological, sociological, and social factors. Recognizing and addressing mental health problems requires empathy, understanding, and access to appropriate support and treatment. Stigmatizing attitudes and misconceptions about mental health can lead to harmful beliefs, such as the idea that mental problems are a result of personal failures. Addressing stigma and promoting understanding are crucial in fostering a more inclusive and supportive approach to mental health. Individuals experiencing mental health problems require compassion, understanding, and access to professional support. Encouraging open conversations about mental health, addressing stigma, and promoting access to resources and treatment are essential in supporting individuals with mental health challenges. After hearing only 10 myths, and there are many more, why is there a stigma around mental health? In this channel, we will talk about mental health disorders, coping, things you can do to help, and much, much more. If you would like to learn more about mental health, like, share, and subscribe.